Hi, this is a Federal Register presentation by Sarah Valdez, currently attending Loma Linda University. This presentation is being displayed for course HLIN 347, Advanced Information Privacy and Security, instructed by Professor Terry Rose. The presentation will focus on the proposed rule of the Patient Protection and Affordable Care Act with the HHS Notice of Benefit and Payment Parameters for the year 2021 and Notice Requirement for non-federal governmental plans. I will also cover content based on the date the notice appeared, the history of the proposed regulation, what its origins are, and what agency is responsible. Also, whether this proposed regulation is final. I will also be going into details about how the public was able to respond to the regulation, give description of the new regulation, and how this regulation will affect the health information practitioner. For this slide, we will be looking at the date the notice appeared and the background of the proposed regulation. The Patient Protection and Affordable Care Act, HHS Notice of Benefit and Payment Parameters for 2021, Notice Requirement for Non-Federal Governmental Plans, was a proposed rule appeared on Thursday, February 6, 2020, and Centers for Medicare and Medicaid Services, CMS, or HHS, is responsible for proposing this rule. The Patient Protection and Affordable Care Act, PPACA, established American Health Benefit Exchanges, which allowed qualified individuals and qualified employers to purchase health insurance coverage. Yet in 2017, the President issued an executive order that was meant to weaken regulations and procedures associated with enforcement of the PPACA. This rule on the Federal Register is meant to adhere to the executive order issued, and it is to reduce fiscal and regulatory burdens across different program areas and to provide stakeholders with greater flexibility and also reduce unnecessary regulatory burdens on stakeholders, to empower consumers, and also to ensure program integrity and improve affordability. This proposed regulation is closely associated with the Executive Order 13765, which states that, to the maximum extent permitted by the Secretary of HHS and heads of all other executive departments and agencies with authorities and responsibilities under the PPACA should exercise all authority and discretion available to them to waive, defer, grant exceptions from, or delay the implementation of any provision or requirement of the PPACA that would impose a fiscal burden on any state or a cost, fee, tax, penalty, or regulatory burden on individuals, families, healthcare providers, health insurers, patients, recipients of healthcare services, purchasers of health insurance, or makers of medical devices, products, or medications. CMS is committed to promoting a consumer-driven healthcare system in which consumers are empowered to select and maintain healthcare coverage of their choosing. Is this a proposed regulation or a final regulation? Originally, this was a proposed regulation back in February of 2020 and was later finalized and released on May 7th of 2020 and will be taking effect in July of this year. The Centers for Medicare and Medicaid Services, CMS, finalized standards for issuers, exchanges, and accepted benefit health reimbursement arrangements sponsored by non-federal governmental plan sponsors. Overall, the final rule minimizes the number of significant regulatory changes to provide states and issuers with a more stable and predictable regulatory framework that facilitates a more efficient and competitive market. These changes further the administration's goal of lowering premiums, promoting program integrity, stabilizing markets, enhancing the consumer experience, and reducing regulatory burden. Now, how the public could have or how they did respond. According to the Federal Register, individuals who wanted to submit comments about this rule had to submit comments no later than March 2nd of 2020. CMS allowed the public to respond electronically on the regulations.gov website or by mail to CMS Department of Health and Human Services, HHS. Although this volume was from February and did not provide any comments, I was able to look up a different volume published in May to see the kinds of comments that were invited. HHS received 1,082 comments on this proposed regulation. Comments were received from state entities such as departments of insurance and state exchanges, health insurance issuers, providers and provider groups, consumer groups, industry groups, national interest groups, and other stakeholders. The comments range from general support or opposition to the proposed provisions to specific questions or comments regarding proposed changes. They received a number of comments and suggestions that were outside the scope of the proposed rule that are not addressed in this final rule. HHS first addressed comments regarding the publication of the proposed rule and the comment period. For example, multiple commenters criticized the length of the comment period, stating that a longer comment period is necessary to allow stakeholders to review the proposed rule and provide thoughtful comments. The response to this was, the timeline for publication of this final rule accommodates issuer filing deadlines to the 2021 plan year. A longer comment period would have delayed the publication of this final rule and created significant challenges for states, exchanges, issuers, and other entities operating under strict deadlines related to approval of products. Description of the new regulation. This final rule sets forth payment parameters and provisions related to the risk adjustment and risk adjustment data validation programs, cost-sharing parameters and cost-sharing reductions, user fees for federal facilitated exchanges and state-based exchanges on the federal platform. It also finalizes changes related to essential health benefits and will provide states with additional flexibility in the operation and establishment of exchanges. The rule includes changes related to cost sharing for prescription drugs, notice requirements for accepted benefit health reimbursement arrangements offered by non-federal governmental plan sponsors, exchange eligibility and enrollment, exemptions from
from the requirement to maintain coverage, quality rating information displayed standards for exchanges, and other related topics. This final rule also repeals regulations relating to the early retiree reinsurance program. American health benefit exchanges are entities established under the Patient Protection and Affordable Care Act, PPACA, through which qualified individuals and qualified employers can purchase health insurance coverage in qualified health plans, QHPs. Many individuals who enroll in QHPs through individual market exchanges and eligible to receive a premium tax credit to reduce their costs to their health insurance premiums and to receive reductions in required cost-sharing payments to reduce out-of-pocket expenses for health care services. CMS amended some of these provisions and parameters, which focus on maintaining a stable regulatory environment. Risk adjustment continues to be a core program in the individual and small group markets, both on and off exchanges, and CMS finalized the proposals to recalibrate the risk adjustment models used in the state payment transfer formula of the HHS operated risk adjustment methodology. They finalized changes intended to improve the reliability of risk adjustment data validation, RADV. HHS notice of payment and benefit parameters were finalizing the user fee rates for issuers offering plans through the exchanges using the federal platform. For the 2021 plan year, CMS is maintaining the federally facilitated exchange and state-based exchange on the federal platform. CMS also provided information to QHP issuers on ways in which they can implement value-based insurance plans designed that would empower consumers to receive high-value services at lower costs. Under the finalized rule, there will be lower premiums, CMS will be promoting program integrity. They will be increasing market stability, enhancing the consumer experience, and reducing regulatory burden. Under lowering premiums, CMS is promoting the adoption of value-based insurance designs. Under promoting program integrity, they've come up with the special enrollment period, where they are requiring exchanges to apply plan category limitations to dependents who are currently enrolled in exchange coverage and whose non-dependent household member qualifies for a special enrollment period to newly enroll in coverage with them. For increasing market stability, as mentioned before, is the RADV. It's a finalized modification to the application of RADV adjustments in cases where an issuer's HCC count is low. For enhancing the consumer experience, CMS has provided quality rating information display standards for exchanges. They finalized the changes to the quality rating information display standards for state exchanges that operate their own eligibility and enrollment platforms. To continue providing flexibility for state exchanges, they codify an option for state exchanges that operate their own eligibility and enrollment platforms to display the quality rating information provided by HHS, or to display quality rating information with certain state-specific customizations of a quality rating information provided by HHS. And lastly, reducing regulatory burden. They've implemented Early Retiree Reinsurance Program, ERRP. They finalized the deletion of regulations relating to the ERRP and expired January 1st of 2014. All ERRP payments have been made and there are no outstanding claims or disputes. A portion of the original appropriation remains and will be returned to the Treasury when the appropriation is closed out in due course. As far as how this regulation will affect the health information practitioner, I found that it wasn't really going to affect much. According to the Federal Register, the finalized rule requires that issuers must report prescription drug rebates and other price concessions receiving and retained by an entity providing pharmacy benefit management services to the issuer as non-claims cost. Issuers must also report expenses for services outsourced to or provided by other entities in the same manner as issuers' expenses for non-outsourced services. This concludes my presentation. Thank you for your time.